and gentlemen, this is a story that came out on Vox.com. I'll leave the link to this article in the description box. They're admitting they're failing at the opioid plague. Are we surprised? No. No, we're not, because the stories that I have done over the past year is very clear that they are not finding a solution for this thing. And Narcan is just a Band-Aid. But it certainly is not stopping the high number of people that are still overdosing. So let's get into this story that came out on the 23rd of August, 2018. The opioid plague is the deadliest drug overdose crisis in U.S. history, on track to kill more people over the next decade that currently live in the entire American city like Miami or Baltimore. A new study published in the American Journal of Public Health on Thursday by Stanford researcher Allison Pitt, Keith Humphreys, and Margaret Brando tries to parse out how America can reduce the death toll using a mathematical model. The study brings together research and expert opinions to calculate the epidemic death toll and how different policy ideas can stem the toll. So they're saying that it's 510,000 people, which is a rough estimate, but I'm telling you, every number they give, just anticipate that it's low. That's a rough estimate on how many people will die over the next decade due to opioid-related causes, which include overdoses and other causes of death tied to opioids, such as HIV infections from sharing syringes. But the researchers caution that the number, as with other estimates in the study, are fuzzy and subject to change. Given that this is, after all, trying to predict the future, the trend that we've seen in the last year would suggest that there's reason to believe that death toll could be even greater. No, it is. Really, Pitt told me, referring to data showing a rise in opioid overdose deaths in 2017. But it's really hard to say. Now, let me just go down. Now, they're looking at potential solutions. No defense, but common sense should tell them the way that they're doing things is not working. And their solution is give amnesty to the drug addict and anybody that calls 911, and they shouldn't go to jail. It's a public health issue, and we need more Narcan on the shelf. Those are not solutions, y'all. I think if you don't know that by now, you just simply don't want to know it. I mean, you have all those things in place, and it's not putting a dent in the number of people that are dying. Then common sense needs to tell you that those things are not the solution. The model, for example, estimated a wider availability of naloxone could reduce opioid-related deaths by 21,200 over 10 years. That medication-based treatment for opioid addiction, buprenorphine and methadone, would reduce deaths by 12,500. And that reductions, painkiller prescribing for acute pain would reduce death by 8,000. And these are, first of all, they've already reduced prescribing it. Those are not the answers, ladies and gentlemen. And let me explain why none of those things they're proposing is the answer. Because you know what? There's always the street drug. And they're not even talking about the street drug that people are going out there and getting. What's killing people today is mainly fentanyl. And it's fentanyl mixed in with other drugs. And they're talking about all this other stuff, and they're completely leaving out fentanyl. And this is why what they're proposing is just a load of garbage. And it's not going to do anything in reducing deaths if you don't do anything about the street drugs, period. Again, researchers caution that the individual numbers here aren't too important, since this is a model making predictions. These figures are not totally acute. Instead, what's important is the overall story that they tell us. So as you can see, over the last 10 years, these are things they got in place. They got the needle exchange in place, where your drug user can get clean needles. Psychosocial treatment, medication-based treatment, and naloxone availability. Those are things they got in place in the last 10 years, and these deaths are still in high number. On the harm reduction and treatment front, the model suggests that several interventions, more naloxone, more needle exchanges, more medication-based treatment, more psychosocial treatment. Where it gets a little messier is the prescription painkiller control side. With these policies, the model suggests that some intervention could actually increase the number of deaths within 5, and in fewer cases, 10 years. How different policy intervention would affect opioid-related deaths over 10 years. So these are all predictions, and this is just a model of it and reducing it. But like I said, the biggest problem in their research, they don't even touch on the street drugs that are out there. So, I wish them the best. I don't know how you keep going with the status quo every day and you expect to see change. Obviously, somewhere along the line, somebody needs to be smart enough to realize what you're doing is just simply not working. And as long as they keep repeating the same thing over and over, they're not going to see any changes, y'all. It's what they're proposing is a dream. Even this thing, this is a dream. You can't say we're going to do something about it, and then you leave out the heroin, you leave out the fentanyl, you're leaving out the meth, you're leaving all these other drugs out in your study. So I just don't know what good this is supposed to do when you haven't even hit on another major part in what's slowing down the efforts of turning this thing around. Not to mention, you got Trump that has given very little money towards this epidemic. He hasn't done anything. Anybody can pick up a story and read all the people out here that work, with these folks, with the people that are on drugs. They're saying they're not getting hardly any funding from the Trump administration. So he made it a public health emergency, but he said no new funding. So where do you think this thing is going to go? It's not going to go anywhere. And to be honest with you, I don't think he really cares. He doesn't even talk about the opioid plague anymore. When was the last time he spoke about this? It's been a long time. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.